My name's Alex Wilson. I'm a physiotherapist by training. I qualified in 2002 and I have a role where I split my week between being a clinical specialist physio in critical care and working on the Go Digital agenda within my organisation to harness AHP's use of digital infrastructure. I work roughly 50% of my working week doing my clinical job and being a clinical leader and a clinical manager. And the other half of my week is split between working with our electronic patient record team on digital projects. So we have in our organisation a Go Digital agenda, and taking that and working with colleagues to really look at and coach. Coaching is a big part of what I do, coaching them in how to use the systems that we have. As a clinician, I can step from treating a patient into thinking how we can improve how we work, how we use digital systems to make our workflow better, and then step back to treating a patient to test that out. Actually having an interest in how systems work and how you think in a systemized way means that when you go back into clinical practice, which could be the next day, a few hours later, you can go, actually, let's really test this out and see how I could do this better. You can bring extensive quality improvement knowledge, extensive knowledge in how systems work, but actually getting involved with talking about how you can make the systems better as a on the shop floor clinician is probably the best education going. There are plenty of people in the system that are the techies that can deliver what you ask them for, but having an experience of using the systems, knowing what you do clinically and understanding that means that you can articulate to technological developers what you want. My advice for people who are interested in getting involved in the digital agenda in their organisations or in the NHS is go and ask the questions, go and ask to have a cup of tea with the Chief Clinical Information Officer or the Chief Nursing Information Officer. That's how I do a lot of the work I do. I go and chat to these people. Yes, I live in a digital world. I don't send that many emails to them. I go and talk face to face because it's so much more effective. I get involved and that would be my biggest piece of advice is just get involved.